the ECG disposable electrodes to the ECG button cable. Stick the disposable electrodes, which is attached to the patient cable, to the patient. Note the color code of the button cable. Red button with electrode to be fixed on the right shoulder, green button with electrode on the left side lower abdomen, and the black button with electrode to be stuck to the lower right abdomen. If the patient has got hair in these areas, slightly move to the place without hair. Alternatively, shave the hair to fix the electrodes. Electrodes fixed with hair may not give proper ECG signal and the output may not be perfect. If the patient's skin is too oily, then clean with a clean swab with alcohol for better contact. After fixing the electrodes, tie the belt provided with the cable around the patient to avoid electrode displacement while doing the test. Resting ECG test. The patient should be in the resting position for this test. Select resting button to take 1 minute ECG in resting position. Patient should not move or talk while the test is progressing. The live ECG will appear on the bottom of the screen, and make sure that the peak of the ECG signal should be more than the red marker line on the left side corner of the ECG screen for better results. If the height is less, then increase the gain switch on the front panel from 1 to 2. The signal is amplified twice the original signal. Even after this selection, the ECG signal is small. Then modify the electrode position on the patient body. You may bring them closer to the heart for better signal. The ECG signal will automatically stop after 1 minute of ECG capturing and recording. Deep breathing test. Patient in supine position, and they should be explained about the test. Patient should inhale deeply and then exhale deeply, such that he does 6 cycles of inhalation and exhalation in 1 minute. That means they should inhale for 5 seconds and exhale for 5 seconds continuously. Select deep breathing button to take 1 minute ECG while the patient is in deep breathing. Supine ECG test. After the deep breathing test, ask the patient to be in supine position and breathe normally before doing the standing ECG. Select supine button to take 1 minute ECG in supine position. Patient should not move or speak during every test. Standing ECG test. Always keep a rubber or wooden platform or mat near the patient couch and ask the patient to stand on this platform or mat. Immediately after he stands, select standing button to take 1 minute ECG in standing position. Patient should not move or talk during this time. Valsalva test. After the standing test, ask the patient to sit on the couch or on an armless chair. Instruct the patient about the Valsalva test. Ask the patient to hold the mouthpiece tightly between their lips. Ask the patient to take a deep breath and blow hard till they reach 40 mm Hg pressure and hold it continuously for 15 seconds. Select Valsalva button, and after few seconds of normal ECG, the patient has to perform the Valsalva test for 15 seconds. When the patient starts blowing, the pressure value is displayed boldly, and the moment the patient reaches 40 mm Hg pressure, the ECG waveform turns to pink from green, and also a red box turns green. The Valsalva hold time is also displayed. When the patient stops blowing or blowing less than 40 mm Hg pressure, immediately the ECG waveform turns green, indicating the end of the Valsalva test. Allow the ECG to stop after a minute. If the patient is not able to blow and hold for 15 seconds, then they can do their maximum possible time. At least 5 seconds they should perform. Otherwise, the interpretation may be supine test. Tie the BP cuff on the upper arm of any one hand. The arrow mark should be on the brachial artery for accurate result. Select BP supine button to take BP in supine position, and during this time, the patient should be in supine position. The built-in noiseless pump inflates the cuff, and the cuff pressure values are displayed boldly. After detecting the systolic and diastolic pressures, the cuff is deflated automatically. BP standing immediate. Ask the patient to stand straight and should not talk or move. Immediately on standing, select BP standing button to take BP in immediate standing position. The systolic and diastolic BP are measured. The counter clock will count up to 60 seconds, and after 60, the BP is taken automatically. This completes the BP after 60 seconds. Sustained hand grip test. The patient should be in resting position. Select BP before hand grip button to take BP when the patient is in supine position. Give the hand grip to the patient, and he should not hold the hand grip by the same hand where the BP cuff is tied. He should hold it in the opposite hand. Ask him to apply his maximum pressure to compress the grip. He should do it in the opposite hand. Select Maximum Pressure button and ask the patient to squeeze the hand grip with maximum possible pressure and hold it for at least 5 seconds and then release. Computer will sense their maximum grip and displays both maximum grip and 30% of the maximum grip. Select 30% of hand grip button and ask the patient to squeeze the hand grip till they reach the 30% of the maximum pressure value, which is displayed on the screen. The pressure value is indicated boldly on the screen. Once reached 30%, a green button indicates the correct pressure. Hold it till the BP is measured after 5 minutes.